This used to be a grocery store serving thousands of Peoria families. Today, it's a symbol of vanishing food access. Peoria has lost 3 Krogers since 2018. One in the East Bluff, South Side, and now the latest on Sterling Avenue.
We were certainly blindsided by the fact that Kroger's was leaving.
According to the USDA, 61604 and 61605 are low-income, low-access food deserts. Many residents live more than a mile from a full grocery store and lack reliable transportation.
The question is there a need for a grocery store, or do people just need more resources to get groceries?
Paul Bota has lived in the 04 for nearly 10 years.
We were starting to get behind on bills. We were starting to get in credit card debt. There didn't seem to be a way out of that.
He works full-time in IT, provides for his 3 young kids, and supports his wife.
It's a beautiful pineapple here.
But as grocery prices rose, putting food on the table started to feel like a luxury. According to the Bureau of Labor Statistics, grocery prices have jumped about 29% over the last decade.
The options were really bad because we trying these stores here, Walmart and Aldi, but still, it was expensive.
The idea that a grocery store would be in a community would automatically translate into people not being hungry is simply not necessarily true. So the question of power allows us to think about asking communities, what do you need to be food secure?
And that was exactly what Peoria Grown asked their community.
We spent a lot of time working alongside our community, building trust, and actually trying to listen and find out what is it they actually need.
For the Bota family, that community solution, Market 309, has been life-changing.
It's been able to help our family reorganize our finances and start to see a path to get out of debt and of course get our family to get fresh food and supplies.
Market 309 offers subsidized produce to people living in 61603, 04, and 05. They also serve Link card holders, seniors, veterans, individuals with disabilities, and Bradley students during the school year. When I visited the market with the Bota family, produce was gone in less than 20 minutes. A sign of how high the demand really is.
We need funding to be able to scale. And we can scale if we get the support from state and city.
About 15 minutes away, a family philanthropy has been working to fill the gap too.
We took what was a garden that we would keep for our own family and grew it and try to provide for more in the community.
Urban Acres was born, and with it, a commitment to green education, access, and collaboration. With the help of partners, Urban Acres hosts a weekly farmers market and runs a community kitchen anyone can rent. Their produce is sold cheap or at a pay-what-you-can price.
When we first started all this, is that we were growing these massive gardens and trying to give produce away, and people are like, ooh, what's wrong with that? Why are you giving it away, right? And there's that dynamic that people don't necessarily want a handout. They want to feel that they're responsible for their own well-being.
The initiative hasn't just fed people, it's cultivated a community curious of growing their own. But with grassroots initiatives come limits.
We are capacity limited by whether it be the land that we own, the amount of time and energy coming from the sun or rain or whatever, and inflation has hit.
But what would be the impact without this support?
We often see a higher risk of obesity, high blood pressure, diabetes, a lot of those types of chronic illnesses that can be prevented when someone has a nutritious diet.
Peoria County Public Health data shows people living in 61605 are dying at higher rates than any other zip code, with heart disease and cancer remaining the leading causes.
When you think about those risk factors, or those factors are supportive factors that help individuals live long and healthy lives, nutrition is kind of a hallmark of it.
One of our family have seen with her diabetes. She was taken off one of her medication because she's been eating what her doctor's been asking her.
So the question remains, what if traditional grocery stores were never the real answer? Who is really stepping up and who's missing from the table? Tomorrow we ask city leaders exactly that.